Good morning. Today we have invited Dr. Sujith Senaviratne, Associate Professor, Director, Cardiac CT Service, Interventional Cardiologist, Monash Heart and Monash University. Good morning and welcome to the studio, Doctor.
Good morning, Sally, and thank you very much for inviting me.
Also, accessing your facilities for people who come around and they feel, without, the screening process, as you said. How does one get about that? Or, coming through the GPs because you got an issue. But if you have an issue and you're a bit worried, what's the procedure?
Yes, the Australian healthcare system is such that you would need to come through GP to access specialist care. Especially if you're talking about the cardiac CT facilities, it's basically, as I said, somebody who has chest pain want to have a definitive answer. It is one of the best tests that you can do. And as I said, if they have symptoms and if the test is actually referred by a cardiologist, it is covered by Medicare. And they may be in some instances with patients who have a very strong family history or very high cholesterol levels, and the question of whether they should go on a cholesterol lowering tablet or not. In those kind of situations, we may also do cardiac CT, and those kind of situations, we also sometimes do what you call calcium score. It's another variant of the cardiac CT. And in those situations, the patient may have to pay a fee for that. And again, that may be accessible either directly by GPs who are aware of the facilities or through a cardiologist. But important.
Just before you go, you were talking about this calcium score. What does that? What's a negative point towards the heart with this calcium score?
The calcium score is another very simple test. As I said, it's a variant of the cardiac CT. All what it is that we take a picture of the heart without having to give any contrast or iodine at all. And that's the difference in cardiac CT. We give iodine or contrast to see inside the artery. With the calcium score, we do not give any dye. And all what it is we're looking for calcium. What happens is cholesterol over time absorbs calcium. Calcium is rock. And when X-ray beam is passed through the rock or calcium, it appears white. So we can see...
It's crystallized.
So we can see the extent of cholesterol which has turned into calcium. That's a reflection of how much cholesterol you have. It doesn't tell you whether that area is narrowed or not, but we can see whether there is cholesterol or not. And we know that more than any risk factor, so more than your cholesterol levels in the blood, more than your smoking, more than diabetes, more than high blood pressure, the most important predictor as to whether somebody is going to have a heart attack or not is the amount of cholesterol in your arteries, so which we can assess using either calcium score in right population or with cardiac CT. So that's how it is used. And another very important principle is that having low cholesterol levels don't actually protect you entirely. So there are a number of people who have a cholesterol of 8 or 9 yet have no coronary disease at all. And there are other people who have cholesterol of 4 or 4.5, and one would think that's an excellent cholesterol level, therefore I cannot have a heart attack, and that's not correct either. You can have extensive coronary disease even with a low cholesterol. There's an association, but it's not a perfect association. So cholesterol level again is not completely protective, but of course you have a lower chance if you got low cholesterol.
And the CT scan can...
CT scan will show you whether you got any cholesterol in your coronary arteries or not.
So even if the score is high or low, it can still have deposits within your
Absolutely.
arteries.
Absolutely.
And talking about aspirin, this buzzword about aspirin and heart and prevents heart attack, is that right?
Well, aspirin was actually very popular some time back. And we would say, well, when somebody maybe past 50 or 60, they should be on aspirin. That reduces risk of stroke and heart attack. But the jury has completely gone the other way around. We know that being on aspirin in low-risk situation increases the risk of bleeding from the gut and also increase certain types of stroke. Therefore, the current recommendation is that if you're low risk, that means you haven't had prior heart attacks and you don't have number of risk factors, there is no benefit being on aspirin. If anything, there may be a harm. So aspirin is no longer recommended just because you've gone past a certain age. If you had prior coronary disease or heart disease, then yes, definitely. And maybe in certain situations where you are at significant risk because you have number of risk factors, yes, maybe in that situation. But I certainly wouldn't start aspirin just because you have hit a certain milestone in your age. That is no longer recommended.